So give us an idea, and I'm going to invite people to call, not quite yet, but we will in a moment. Give us an idea about some of the subject areas that your book touches upon that people either, again, people who have reached an age of maturity, retirement, and also, again, their children who themselves are going to be facing the maturity issue 20 or 25 years down the line, but are going to face it immediately with the aging of their parents. So you're really talking about a book that anyone from the age of 30 on should at least be thinking about. What are some of the issues that you touch upon?
Well, I think first and foremost, why are older people different? What makes an older people? I mean, an 80-year-old person is just not a 50-year-old who happens to be 30 years older. You can't treat the person the same way. So why do we need a specialized, a different approach to an older patient? The issue of homeostenosis. Their internal reserves are very limited. A person may be very healthy, but a simple cold can throw them literally off the cliff. Their internal reserves, they can't withstand stress of disease, for example. Then there is this concept of heterogeneity. Put 10 40-year-old people in a room, males or female, they all look very similar from a medical point of view. No regular medications. They haven't seen their primary care physician. They don't have any chronic diseases. Put 10 80-year-old people in the room, and you'll see somebody who take 5, others take 15, 10 medications. Some are in a wheelchair, some have dementia, some have stroke, some have heart disease, arthritis. A tremendous amount of heterogeneity. And so understanding that you have to treat these people differently is very important. And also that the older person understands that. We are different. We need a different kind of approach.
And are there things in your book that either older people or the children of older people can learn to make the aging process easier?
Well,
can't stop it.
No, you can't
Might
stop
not
it.
even be able to slow it down, but maybe make it easier and more understandable?
Right, and the way to do this is to become an informed partner. You have to really know what's happening. I mean, I remember the case, and I outlined it in the book, of a wonderful Italian lady who had this beautiful book of recipes from her grandmother and mother about pastas and all sorts of things, and it was meticulously put together. But when it came to her pills, she would come with a Ziploc bag of pills and says, "Doctor, get me off these pills." And I would ask, "What are these pills?" "Well, I don't know. They're just the pills you give me." So, I wish you would take a little bit more sort of care about the pills. Know what
more precision.
Yeah, know what these medications are for. Know the two names. There are pain behind these names, but you need to know what they're for, and know some of the issues why we treat the hypertension, why we want to treat the diabetes. Know why falls are important. I mean, be an informed partner in your care, and this book helps you to be that.
All right, the book is Aging But Never Old, The Realities, Myths, and Misrepresentations of the Anti-Aging Movement. I'm going to talk about what the anti-aging movement is. My guest is Dr. Jürgen Bludau. He is a internist and also a geriatrician at Brigham and Women's Hospital in Boston. And if you have a question, oftentimes when we have Dr. Larry Cohn, the heart surgeon, on, and now we have Dr. Bludau on, my guest this hour is Dr. Jürgen Bludau. He is, as I said, an internist, but he's also a geriatrician, which means he specializes in the issues dealing with older folks. If you'd like to join us, 617-254-1030. In this book, there is an immense amount of information about virtually every, and it's not a long book, by it's less than 200 pages. Frankly, it's less than 180 pages, well annotated, and you even get into things like last will and testament. So you get into the legal realm as well.
That's right.
And that's important as well. But this is something that if you are old, you may want to look at this. I assume available. Just has come out late this year.
Right.
And
it's available on Amazon, and there's actually a book signing tomorrow evening.
Where's that going to be?
At the Boylston Borders on 511 Boylston, I think.
Downtown Boston?
Downtown Boston, yes.
All right, so you have a chance to meet the doctor as well. we're going to incorporate phone calls. I got a lot of questions here, but if you want to ask a question, Dr. Bludau, you got to call 617-254-1030. So we're going to take Ava from Maine. I'm not going to hold Ava on, but I'm going to get some more questions in as well, and you're welcome to call. Ava, how are you tonight? Hello,
Good
Ava.
evening.
How are you?
Hi. I'm well, thank you. This is a subject that's near and dear to my heart. Basically, I moonlight as a part-time situation on my own. I'm self-employed as a senior navigator and elder advocate.
Wow, I've never heard that phrase, senior navigator.
I think I might have actually made that up, but That's the beauty of being self-employed. But my expertise is I graduated from college with a degree in gerontology back in 1980 when it was very difficult to find that major. And I had to search, and it was just something that was very interesting to me. I grew up with all of my 4 grandparents, and what I used to do was oral histories, and I don't know if the doctor is at all interested in that, and I'm very eager to get the book myself, read it, and then hopefully be able to offer my clients, who very often are the children of aging parents, and basically my issues are anything to do with non-medical issues. So as people live longer, which is, I believe, what the book is about, the social aspects and other things that come up within the family. And so one question I had was this: do you feel that it's our own culture here in this country at this point in our timeline that makes us look at this a little bit differently? Because now that people are living longer, now what, so to speak? Because even so much as the housing, where people.
Well, let's do this. Let's give the doctor a chance to respond, Ava. I think you're opening up a huge can of worms. Let's talk about the timing. We are a healthy society, medical advancement. Dr. Bludau?
Yeah, Ava, I think you've got a very good point here. I think our medical system in this country is very good in dealing with acute care. We can solve or we can keep people alive after major heart attacks. We do well with strokes. People have multiple fractures. We can do so much in the acute setting. What we are left with is our many older people who suffer from chronic diseases. They have survived a heart attack. They are doing well after a stroke. They've had major operation for cancer, and all of this went well, but now they're left with many chronic diseases. And this is where our healthcare system falls apart, because we don't do well with chronic diseases which require care. Care is expensive. Care is not what is really part of this healthcare system. It's the acuteness which we can deal with, not the chronicity of disease. And I think that's part of the problem, what we're seeing now with our healthcare system.
I agree with that, and part of what I do is basically handle those questions so people are left with dealing with long-term and how to deal with it. The other question I had, do you think sometimes some of the issues might come in with, of course, dementia and Alzheimer's coming to the forefront, but sometimes I think that it could be a drug interaction, and I'm not sure if the geriatricians take that. Well, I know you mentioned it in your opening statement with the woman with the Ziploc bags, but I find that is a very big issue. Yep. Someone can get a prescription and then take this once a day in the morning.
Let's get Dr. Bludau's reaction to that.
And you're right. I mean, this entire issue of medication, there's an entire chapter just focusing on medication, very important. And that is geriatrician, internist, family practitioners, or any specialist, we oftentimes really do not know how some of these medications interact. What what we need to know, therefore, is be very careful of what we give these patients. So one of the important things we talk about in our clinic to our patients is, have you taken any other medications? What other medications are you taking when you've seen a specialist? We reconcile their medication list very carefully each time they come, and I always ask them, are you taking any supplements? And sometimes they're honest, and sometimes I will call them up and say, look, some problems with your liver functions. Well, maybe it is the supplement I took because my brother-in-law sent from God knows where. So the point is, again, be a good partner in your health. Be honest. Tell us if you're taking any supplements. That's fine. But inform yourself and let your doctor know what supplements you're taking.
One of the things that I think your book gets into, which is important, it obviously gets into the medical issues. My guest, by the way, Dr. Jürgen Bludau, aging but never old. You talk about the realities, the myths, and the misrepresentations of the anti-aging movement. What do you mean by the anti-aging movement?
There's a very well organized, let's say, business movement called anti-aging medicine, which promotes lots of things, but their main sort of message is that we can stop aging. We should clearly fight it. We can reverse it, and part of their advertising and their advertisements are excellent. I mean, their message is pretty good. Unfortunately, it's not proven. And they've gained some status because they use the word medicine. It is accepted, anti-aging medicine. We talk about that, but it still doesn't help their products. It's essentially lots of products which don't really reverse the aging.
Are these the sort of programs, and I think you hear them on radio stations sometimes, where they're saying if you take this supplement or you take this vitamin, either the explicit or the implicit promise is that it's going to, as you say, stop the aging process. And
this memory factor and enhancement, all of that is not proven. I mean, literally, I can come along, give my patients a bottle, or sell my patients a bottle. Just a bottle with a pill in there, and I can say this will improve your health and immune system. I'm not saying it will cure your wrong or your immune system, or it will cure your dementia or your arthritis, but it will help it, and I can sell it. It's not regulated. No FDA regulation. I can literally
So as long as it's not characterized as medicine, is that?
No, as long as I don't say it cures anything.
So that's the one word. So yes. It will help, it will improve.
It will improve, it will make you feel better. I can do that. But as long as I don't say it will cure, I can sell this.
Okay, so how is that different in America, in the late 19th century, early 20th century? There were people who literally drove from town to town, and they sold magical potions or whatever off the back of the truck. Nope. It's really just moved into the 21st century.
Yeah, Dan, you're saying it. It's no different than the potions sold at marketplaces several hundred years ago.
Okay. When we get back, besides getting some calls here, I want to also talk to you about what people generally can do. In other words, I take, for example, a multivitamin every day. I take a vitamin C tablet, which I really believe in. I don't know what you think about that, but I've been very lucky in terms of just a common cold. I also take a magnesium pill every day, which is done at the suggestion of a great friend and a great medical professional, and I do that, and I want to talk about that, and I also want to talk about quality of life. And if there are some older folks out there who want to be honest, one of the things that is a taboo is we never talk about older people and their sexuality, and that is addressed in your book, and we're going to address it here on NightSide as well.